Installing the straps is simple. The top strap hooks onto a specific system located against the bottom, so as not to rub against the patient's back. The lower strap must be placed below the upper one, so that it can then wrap around the pelvis. For lumbar traction, it is important to unlock the table so as to have a system that will follow the movement of the patient's pelvis. This is very comfortable and also prevents the counter supports that are placed under the knees from slipping. Place the patient on the straps. Before installing the straps, the patient is recommended to wear only one layer of clothing, preferably cotton, to prevent them from slipping. Grip the underside of the rib band, pulling tight enough for a secure fit. Caution: if the top strap was not sufficiently tightened at the start, the patient may find themselves in an uncomfortable position. To avoid this, it is recommended to apply axillary counter supports. Position the lower strap under the pelvis, then fix it on the iliacs. Patients should not wear belts or other accessories that could interfere with the treatment and cause injury. For extremely thin people, add 2 small foam pieces to the areas of friction to avoid pain on the anterosuperior iliac spines. Install and tighten the black traction strap sufficiently. Caution: if the strap is not sufficiently tight, it will pull during traction and rub on the hips, which can be uncomfortable. Attach the hook of the bottom strap to the ring on the traction strap. Release the cord from the device by pressing the button, then hook it onto the ring. Release again, holding the cord with your fingers to avoid jerking. Add counter supports under the patient's knees to provide better comfort during the session. Leave a little space between the legs for the cord to move. For heavy traction, it is advisable to add axillary counter supports to limit the patient's slippage. The patient will slide gradually, but will then be stopped by the top strap and the counter supports. For lumbar traction, for lumbosciatica, go to Clinical Protocols on the home screen. In this case, select the lumbar category, as the patient has mild radiculopathy. Go to Edit mode to check that the protocol is suitable. Here, intermittent over 30 minutes. It is possible to adjust the traction level manually, either directly using the minimum and maximum level or based on the patient's weight. For example, for a 121-pound patient, choose the amount of traction force that will be used as a percentage of the body weight. Everything is configurable. It is possible to easily modify the pulling weight to pull harder, up and down, from one session to another. Press the Start button to initiate traction, which will follow the pattern shown. After installation and adjustment are complete, give the patient the emergency stop button. This will sound a buzzer, stop traction, and cause gradual release. The patient should be as relaxed as possible throughout the session. Return to the home screen and press Start to begin the program. The tabletop will move gradually throughout the treatment, which is a major advantage in the use of this product. At the end of the session, the cord is gradually released. When it is completely relaxed, the hook, the auxiliary counter supports, and the straps can then be removed. Let the patient rest for 5 minutes, then lift them up while respecting the ergonomic rules to give them time to recover a satisfactory muscle tone. After a session, the patient is extremely relaxed and should not risk the benefits of the session by moving too quickly.